Okay.
Assalamualaikum warahmatullahi wabarakatuh. My name is Dwiki. I'm from English Teacher Education Department. I'm going to talk about diseases. That is tetanus. The first is, what is tetanus? Do you know what is tetanus? Tetanus is a disease. Tetanus is a serious infection, a bacterial infection. The bacterial exists in soil, manure, and other environment agents. A person who experiences a puncture wound with a contaminant object can develop the infection, which can affect the whole body. It can be very fatality. Tetanus is medical emergency, and it will need aggressive wound treatment and antibiotics. Number 2 is about symptoms. The symptoms of tetanus. The first is tetanus symptoms usually emerge about 2 until 10 days after initial infection. However, this can vary from 4 until 6 days and 3 weeks, and in some cases may take a month. And muscular symptoms include spasms and stiffness. Stiffness usually starts with the shivering muscle, hence the name Luke's jaw. Muscle spasms then spread to the neck and throat, causing difficulties with swallowing. Patients often have spasms in their facial muscles. And breathing difficulties may result from neck and chest muscles stiffness. In some people, abdominal and limb muscles are also affected by tetanus. In several cases, the spine will arch backwards as the back muscle become affected. This is more common when children experience in tetanus infection. And most individuals with tetanus will also have the following common symptoms. The first is bloody stools and diarrhea, and fever, headache, sensitivity to touch, sore throat, sweating, and rapid heartburn. Okay, next. This is a simple common symptom from tetanus. There is heavy breathing for children and also from adult women or men. Okay, next. Yes, this is a variety of the symptom of tetanus. The least simple symptoms. The first is bloody stools, diarrhea, it's common, and fever, headache, sensitivity to touch in the area of our body, and sore throat, sweating, and rapid heartbeat for children actually. Next, please. And the treatment for tetanus. Any cut or wound must be thoroughly cleaned to prevent infection. And a tetanus-prone wound should be treated by medical professional immediately. You should go to the doctor or professional because the tetanus is very important and very crucial. A wound likely to develop tetanus is defined as a wound or burn that requires surgical intervention that is delayed for 6 hours, and a wound or burn that has considered amount of removed tissue, and wound or burns in patients with systemic sepsis. Any patient with a wound listed above should receive tetanus immunoglobulin as soon as possible because it's very crucial diseases that can make our body is very dangerous in the dangerous moment. And inserting muscle spasm and stiffness, patient may be prescribed. The first is anticonvulsant such as diazepam, and muscle relaxant or such as baclofen. And neuromuscular blocking against block the signal from nerves to muscle fibers and are useful in controlling muscle spasms. And the crucial treatment on the final treatment is we have to do the surgery if the doctor thinks the tetanus is prone one is very large. So we have to do the surgery. And we need some nutrition for treatment the tetanus, because the tetanus is very dangerous diseases if we don't do anything to treatment this. And about ventilator, some patients may need ventilator support to help with their heavy breathing if their vocal cords or respiratory muscle are affected. Okay, we will going to the causes from tetanus. Next, the causes. Tetanus is caused by Clostridium tetan bacterium. This is from a medical name, and Clostridium tetani pros are able to survive for a long time outside of the body. And this is the Clostridium tetani will spread in our body and will spread very fast, and it's very dangerous for our body. So we have to treat the tetanus as soon as possible. When Clostridium tetani enter the body, they multiply rapidly, are released tetanus neurotoxin. And common ways to contracting tetanus include okay, please next. Common ways to contract tetanus include wounds that have been contaminated with saliva or feces, and burns, the burns wound, crush injuries, wound that included dead tissue, puncture wound. Rare ways of contracting tetanus include surgical procedure, superficial wound, insect bites, compound fractures, intravenous drug use, injection into the muscle, and dental infection. Next, please. And the prevention. Most cases of tetanus occur in people who have never had to the vaccine or who did not have a booster shot within the previous decade. And the tetanus vaccine is routinely given to children as part of the diphtheria and tetanus toxoid and axillar pertussis shoot. And the DTaP vaccine consists of 5 shots, usually given in the arms or thigh of children when they are aged. Next, please. The TETANUS vaccine consists when children they are aged 2 months, 4 months, 6 months, 15 to 18 months, and until 6 years. 6 years old for children. Okay, next. Thank you. Okay, this is tetanus. We are prevent. We have discussed about the tetanus. What is tetanus? What is symptom of tetanus, and how to treatment the tetanus and the effect and other tetanus effect. I think that's all. So I hope this can make us very know about the tetanus and how to avoid the diseases. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.